Hello everyone, my name is Dr. Rohit Arora. I'm heading the Department of Pediatrics and Neonatology at Apollo Cradle and Miracles Mediclinic, Gurgaon. As part of this webinar, I'm here to answer your queries, and the topic would be care of the newborn. Any general questions related to the newborn period, you're welcome to ask, and I'll try to answer those questions to the best of my abilities. Apart from that, if you have any pediatric questions also, I'll be happy to take that as well, apart from this chosen topic. So just to begin, I guess I'll start by saying that the newborn period is it's a very happy moment for the family, but at the same time, it could be stressful time for the newborn because the baby has come out from a very convenient gentle environment from the mother's womb outside in the stressful environment of the house. So baby only recognizes mother's voice, mother's heartbeat, mother's bowel sounds. So any other voice apart from these could be stressful for the baby. The whole family is excited to have the baby around, but you have to be respectful of these facts. And also the immunity levels of the babies in the first 2 months are quite low, and therefore they are prone to infections. Okay, I'm supposed to be a little louder. So I was saying the immunity levels of the babies in first 2 months are on the lower side, so babies are prone to catch infections. So the care should be taken to all sorts of care should be taken to prevent any such infections. Okay, I'm supposed to get question. I think I've started to get questions already. So the first question which I have got, it says my baby's skin looks bluish. Is that serious? Okay, so yes and no. If the hands and feet are bluish, then that's normal in first month or first few months of life. Baby's nervous system is not very well developed, so the peripheries can become cold and therefore turn blue, which is normal. However, if the lips, the face, the tongue becomes blue, then yes, it can be dangerous. So that needs to be immediately sorted out, and you have to consult your respective physician for that. All right, I have a few more questions lined up. There's how should I bath my baby? Please suggest. So keep things simple, nothing rocket science around it. Please keep the simple bath technique, but make sure you don't bathe the baby in the bathroom. Bring a bathtub inside, preferably inside your bedroom, because that's where you can make the environment a little warm and cozy. Use lukewarm water, and maybe the baby bath soap can be used. So try and use liquid bathing soap. Try not to put water on the head. Let the first get used to holding the baby and then giving a bath below the neck. And once you're comfortable holding the baby, then start to pour water on the head. Make sure water falls backwards, not forward. That's all. Just keep things simple. All right, another one, are newborns at risk of getting dengue? Yes, they are. In fact, for the last 2 years, we have got dengue cases in the newborns as well. We have managed quite a few babies. In fact, we wanted to report such cases in the medical literature, but then we found a lot of NICUs were getting all this. So it's becoming common. So dengue virus can be acquired from mother to the baby or directly to the baby by the mosquito bite. And these dengue cases can be very serious because, as I said previously, babies are prone to infections. So yes, it's common and it is more serious than the usual adult cases, dengue. All right, a lot of questions. So I have another one. How should I bathe my baby? I think I've already answered that question. So I'll skip to the next one. This is from Mr. Vikas. Is soft spoken on baby head dangerous to touch? I think what he means is the soft part on the head. It is dangerous. Don't know, for just gentle touching doesn't harm the baby. You can easily touch that place. You can comb the hair, you can give a head wash, no problem. Gradually, as the baby grows, it tends to fill up, and generally it should fill up, that space should fill up within a year or so. Upper limit for that time is 18 months, but generally what we see is that generally closes within a year itself. So yes, it's a, you can touch that part, but of course, like any other body part, should not be hard on that surface for sure. Okay, next question is, oh, thank you. There's a thanks. Thank you very much for asking the question. Next question I have is, does my newborn need a bath every day? Okay, I guess people are quite fascinated about babies' baths. So, but don't worry, babies are not dirty. They don't go out and play football. So generally they are clean, but in our culture there's a requirement for the bath. So even sponging, gentle sponging is good enough most of the times. But yes, sometimes, in fact, most of the times babies really enjoy the bath after, especially after a few months of age. So the question is, does my newborn need a bath every day? So my answer would be probably not every day. In fact, first 2 weeks, generally bathing should be avoided because you don't want the umbilical stump which is left to get wet. Okay, the wet umbilical stump will not fall early, and B will get prone to infection. So if you want the umbilical stump to fall early, please avoid making it wet. Keep it dry, nice and dry, and then it will fall sooner, and you can avoid infections also through this simple measure. After that, once it falls, let the base also dry up, and then maybe you can think of giving bath, and you can actually do it alternate days or even like twice in a week or so. No need to give a daily bath to the newborn baby. Okay, so far I've received these questions. Okay, there's another one. Okay, same question, I guess. Oh, our population is really fascinated by baby's bath. So it says, does my newborn baby needs to bath every day? So same question as I just answered. Not really, but again, there's no hard and fast rules. If the weather is warm, you may actually give a bath regularly also, but it's not mandatory that you should give bath every day. Alternate day or twice in a week bath is as good as a daily bath. Okay, having said that, after a couple of months, yes, babies tend to enjoy bathing, so then you can give, but not in the newborn period. Okay, so enough of bathing stuff. Um, I think I'll move on to some of the tips which I think I'd like to share. So, mother feeding, I'd like to stress upon. We at Apollo Cradle, we are very passionate about mother feeding. There's thanks message coming up. Thank you very much for asking the questions. So mother feeding is baby's birthright. Please think from these standpoint. Just because babies can't speak for themselves, so you need to understand the importance of breastfeeding. I can go hours and hours talking about the importance of breastfeeding for the baby as well as for the mother. But long story short, that it is baby's birthright, and it prevents all sorts of infections. It prevents long-term diseases like diabetes, hypertension, heart diseases, cancers. Lots of cancers are avoided if babies are. So even the IQ levels, the depression, whether baby will become depressed in future. So all sorts of things are linked to the nutrition of the baby in first couple of years of life. So, and breastfeeding is a paramount part of that nutrition. So please, please, please don't deprive the baby of mother's feed. And you will actually, in terms of monetary things also, if you want to think, you'll actually save lakhs and lakhs of rupees just by giving simple breastfeeding in the first few months of life. Okay, so if anybody wants to ask me anything regarding breastfeeding, you're more than welcome to ask. I'm getting lots of thanks messages for now. Thank you very much for asking. Okay, so I'll probably move on. So newborn babies can look yellow. You asked the question, somebody asked the question, about the baby becoming blue. Is it normal? So it's not normal, as I answered, if it's on the lips or the tongue. But another common thing which you might find in the newborn baby is that they might look yellow at times, and that's called as newborn jaundice, which is quite common in this age group. So almost 80% of the babies born will have jaundice in first week of life at some point, generally starting after the first day. It peaks by fourth to fifth day and gradually settles down on its own without doing anything by let's say 7 to 10 days of life. Um, Almost up to 10% of the babies might need some intervention in the form of phototherapy, which is also a very simple intervention, and generally the jaundice because of it resolves within next 24 to 48 hours of intervention. So please don't get scared when you see that the baby's eyes are getting a little yellow. You might want to consult with your pediatrician whether it's within normal range or not. If mother's blood group is Rh negative, if mother's blood group is O and baby is something else, and if the baby is a little premature, if baby is a bit sick, then these are a little bit of risk factors in which jaundice can further and can increase a little bit more. So you might want to have a look by your pediatrician at that point. Okay, another question, how should I bathe my baby? Okay, I think you joined a little late. I've already answered that question. There's another question coming up. How many dirty diapers should my baby have each day? Okay, so dirty diapers could be because of urine, they could be because of the poop. So if it's poop, there's no, or it could be both. So there's no counting. Babies can pass stool or the poop every time they feed. So it's normal sometimes for the babies to pass up to 15-20 times of poop in 24 hours. Also, it's normal for babies not to pass any poop for even 5 days, 5 to 7 days even, as long as baby is otherwise well, feeding well, sleeping. So in the first few months, babies are trying to find out the normal routine, and so all patterns of poop are very different in first year of life. It could be, as I said, varies from 15-20 times even sometimes per day to once in 7 days. However, the urine output is generally constant. So after first week of life, baby should pass somewhere around 5 to 6 times urine in 24 hours. If that is happening, then you don't have to worry about the number of poops. So I guess that answers your query. Okay, next question I have is how to increase diet for my baby. All right, I need a little more information as to what is the age of the baby on that. But essentially, so I think you mean it's a bigger baby because in first 6 months you are supposed to only give mother's milk and on demand. So whenever baby demands, you are supposed to feed the baby at that point in particular. After 6 months, generally the complementary feeds, which we call as, which is semi-solid food, which is introduced, is started and then gradually build up as per baby's requirement. So in that sense, a very essential point to remember is it's not important what you feed the baby. What is important is how you feed the baby. So you need to understand that it's a huge change in baby's life. That baby is going to swallow, not just swallow something, but is actually has to chew something to eat, right? So it's a huge change in baby's life, which baby has never done or encountered. So be wary of that fact and be gentle with that notion. Feed initially once or twice in a day, and then gradually as per the requirement you can increase the number of feeds per day. Also continue mother's feeding in the first 2 years of life along with, and so in fact up to the first year, at the end of first year also, milk should form 50% of the diet. So complementary feeding introduction is slow and very gradual. All right, no rush. Whole life you have to eat. There's no rush to keep feeding the baby. Okay, so that's about little bit about complementary feeding as well. All right, I have another question which has come up. What should I do if my baby is running a fever before I reach the pediatrician? Okay, good question. It's a common scenario where which parents encounter. So first of all, don't stress about the fever. Fever is a friend. It's not a disease, it's just a symptom. It's telling you that there is an infection, underlying infection. Now, infection could be viral, infection could be bacterial. Why fever comes in the body? Because body bumps up the temperature, so that the best environment for the bacteria and viruses, which is 36, 37 degrees, is avoided. So it's actually a safety measure wherein body is trying to avoid the growth of bacteria and viruses. So don't be scared of fever. However, if it goes very high, then only it can be of some effect to the body organs. So always document the fever. Don't just treat only through touching the baby or just the fact that baby is feeling a bit hot. Never. If the fever is there and baby is symptomatic in the sense becoming dull and lethargic, that it needs to be treated first of all. Secondly, always measure it, and you should measure it the way you measure for adults. So in the armpit, you can put the thermometer and look for the temperature. Only if it touches 100 or more that you're supposed to give some medication. Now your exact question was, what should I do if my baby is running a fever before I reach the pediatrician? Okay, great. So yes, so do it, check the temperature, see if baby is otherwise feeling well or dull or lethargic. If the temperature is 100 or more, you can give crocin drops, which is any paracetamol drops to the baby depending on the age of the baby, and the dose is somewhere around 15 milligrams per kg. So which I guess you would get to know anyways once you visit your pediatrician for fever, then you'll be able to remember it afterwards, and you can use such medication. Also, you can sponge the child a little bit with the normal water, not the cold water. You can sponge just like you wipe the baby after a bath. That way, you're supposed to wipe the child using a wet towel, and it's with the normal temperature water. Yeah, don't use cold water. Don't just sponge the head, which is a common thing which happens. And every time we have to tell the parents to wipe the whole body and not just the head. I guess that answers your query. Okay, dear sir, how can I help my baby bond with me? Okay, that is coming from, I think, from a father. That's a Sumit, Mr. Sumit. Okay. Oh, well, great question. I'm glad dads are asking such questions. So very nice. So yes, it's simple. So kids need both parents for their best upbringing. So yes, dads need to bond with the kids as well. So simple way is to um, spend a lot of time with them. So you need to spend quality time, not just physically being there in the house, but you need to interact with them, talk to them, look in eye to eye. And if the babies are young, you can actually do kangaroo father care, what we call is something called as kangaroo mother care, wherein babies lie close to the mother's chest. Similarly, you can do such things. The fathers can also do such things for the babies that will help them bond with the baby. So, and as the kids grow, you can start to play with them, involve yourself in preparing the feeds for the baby. You may actually feed the baby some kind of complementary feeds if the babies are 6 months and older. So all these things do help with the father's bonding as well. Good, that was a nice question. All right, I have what is newborn jaundice and how do I prevent the occurrence of newborn jaundice in my baby? I think I've answered it a little bit. Now, what is it? It happens because of the immaturity of the liver. That liver is not able to clear the jaundice which is being formed by breakdown of red cells. So jaundice is being formed in all of us, including the adults, but our liver is so efficient that it immediately clears up all the jaundice and doesn't let it manifest in our eyes or the skin. Whereas in newborn babies, it is the liver is still being getting mature, so the jaundice tends to manifest. So it's normal in this age group until the liver gets mature enough. So that's newborn jaundice, and it's physiological, as I mentioned before. And how can you prevent it? As I said, there's no need to do anything about it. Most of the cases, you haven't done anything. Mothers always ask me question, have I eaten anything which has caused this? So no, don't feel guilty about everything what baby does. So you can eat and drink everything whatever you like, but jaundice will subside on its own in a matter of time. All right, unless of course, and of course you need to consult with your pediatrician, because to adjust the levels, what level of jaundice is there. And most, as I said, most of the cases will be within normal range. Okay, more questions coming up. I have baby was 3 months. I would like to ask about the milk powder which was given is isomil. She's have toilet problem. Okay. I think probably the background of this is that baby had very loose stools, A, or that the baby had intolerance to mother's milk. So I need little more information. Is a specialized question. So one of these two reasons, that isomil, which is a soy milk formula milk, which is started in situations wherein either baby has some congenital problems, wherein they cannot tolerate milk, conditions like galactosemia or even cow's milk intolerance, that babies don't tolerate milk, or the fact that they have prolonged diarrheas, loose motions, excuse me, that babies are prescribed sometimes soy milk formulas. So question was, I would like to ask about the milk powder which was given. Yeah, so isomil is actually a soy milk formula, and as I said, in these conditions it is prescribed. And once you have started at this age, 3 months, so it should be generally continued for at least a year before you would want to switch back to cow's milk formula. So yeah, be in continuous touch with your pediatrician, and pediatrician need to look for the signs of cow's milk allergy versus not. And then later on, as the baby grows, the use of another cow's milk formula or something else needs to be looked at once the baby goes past beyond 1 year of age. Okay, so yeah, a lot of thank you messages. Thank you very much. Any questions? I'll be happy to take. So if baby has got jaundice, as I said, you don't need to change anything. The feeding and everything else stays the same. The phototherapy brings down the jaundice level. These days the phototherapies have become very advanced. They bring down the levels very fast. In the olden days when we were doing our post-graduation, we used to do a lot of something called exchange transfusion, wherein we used to change the blood of the baby to bring down the jaundice. But these days the lights are so effective that the jaundice generally comes down within 2 days itself. There are certain rare instances where jaundice can go very high, but even those are generally tackled well by these lights, which are LED lights, which are available. Okay, I have one more question now. When I help to make my baby sit, she brings out milk afterwards too. Is it normal? I assume your baby is still less than 6 months. Generally sitting comes only after 6 months, and generally babies are comfortable enough to sit on their own. If you're trying to do it before that, you can keep trying off and on, and if some spit ups happen, that's normal. But if they are happening regularly, maybe you might not want to keep trying. First thing I would suggest you should do is keep the baby on their belly. That will help strengthen their belly muscles, and eventually so that they become ready to sit on their own. So yes, make them spend at least 30 minutes to 1 hour of tummy time in their third, fourth, fifth month of age, which kind of prepares them for